What does that mean for you, the patient, when you hear that kind of certainty from a doctor? Are they always the final word?
Well, this is where that critical thinking piece comes in, right? Openshaw's view is that doctors are consultants. Highly trained, yes, but consultants, not the ultimate authority on your body.
Ready to live at the higher vibrations, where peace, love, joy, and good health are the daily standard? That's what this show is all about. Welcome to Vibe. And here's your host, Robin Openshaw.
Hey, welcome back to the Vibe Show. I'm your host, Robin Openshaw, but I want to introduce you to my AI assistants. I call them Bob and Betty. And they're basically like radio talk show hosts who are going through a piece I wrote about my family's experience with oral surgery, because it's become the de facto preemptive, so that you don't get an infection thing, to have everybody before oral surgery take a steroid and an antibiotic, and they give you an opiate for painkillers. And so to me, that's just like overkill. And so that's not what I do if there's an oral surgery in my family. And I wanted to let my AI assistants tell you the story. Here it is.
Okay, let's dive in. Imagine you're facing oral surgery. You know, what's the usual deal? Often it's, a stack of prescriptions, right? Antibiotics, steroids, maybe some strong painkillers.
Mm-hmm.
But what if there was another way? A different path through that experience, maybe avoiding a lot of those conventional drugs and, their side effects. That's exactly what we're getting into today. We're looking at the experiences of Robin Openshaw. She's a longtime holistic health author, and she shared how she and her family handled oral surgery using this, surprisingly collaborative and much more natural approach.
Yeah, and it's fascinating because her story really pushes back against some common ideas, that certain medications are absolutely mandatory before and after surgery. So we'll look at why those drugs are typically given, what the potential long-term effects might be. And then the really interesting part, the natural alternatives and strategies that Openshaw found actually worked. Our goal here is really to give you some perspective, maybe some new knowledge about a route that's, less commonly taken in dental care.
So let's start there with the standard situation. You get told you need oral surgery, maybe it's impacted wisdom teeth, like for Openshaw's son, Tennyson, and boom, almost right away, prescriptions for some pretty strong drugs land in your hand. What's actually going on when surgeons prescribe things like steroids and antibiotics almost as a default?
Well, that's a key question, isn't it, about the drugs themselves? I mean, traditional antibiotics, especially the really potent ones we have now, they can just wreak havoc on your gut microbiome. And that's crucial because, most of your immune system lives there. This disruption can cause lasting problems, SIBO, general gut issues, or even something really nasty like C. diff, the superbug. Openshaw points out that some people struggle for years after just one round of antibiotics.
Right. And what about steroids? People think, they just reduce swelling. But it's more complicated than that.
Exactly. They do reduce inflammation, yeah, but their main job is suppressing the immune system. And Openshaw brings up a good point. These things can linger. They can stay in your tissues, your organs, your blood for up to 6 months. And the side effects are pretty well documented and can be significant.
Then you got the opioids. Openshaw mentioned a personal worry about addiction, even when they're prescribed for totally legitimate pain.
And that connects to the bigger picture, absolutely. Prescription opioids. It's a massive billion-dollar industry for a reason. They're highly addictive. Now, don't get me wrong, they can be incredibly helpful for severe short-term pain, but the worry is real. Addiction can start from managing legitimate pain. Openshaw even worried about her son liking ibuprofen a bit too much, which flags that sensitivity.
So in Openshaw's case, the oral surgeon basically said these drugs were, quote, important and mandatory. What does that mean for you, the patient, when you hear that kind of certainty from a doctor? Are they always the final word?
Well, this is where that critical thinking piece comes in, right? Openshaw's view is that doctors are consultants. Highly trained, yes, but consultants, not the ultimate authority on your body. She raises the point that, traditional dental training, like a lot of medical training, has historical ties and funding from the pharmaceutical industry. And that can sometimes mean the focus defaults to drug solutions, maybe without always diving super deep into long-term risks. Or maybe there's even a hesitancy to look back at past practices like mercury fillings because of, well, potential legal stuff. It's kind of like that saying, if all you have is a hammer.
Everything looks like a nail. Yeah. Okay, so this is where things get really interesting in Openshaw's story. She got the prescriptions, but she actually decided not to fill the ones for antibiotics or steroids. Instead, she reached out to her biological dentist, a Dr. Michelle Jorgensen, to explore a different path. So first off, what exactly is biological dentistry, and how did this teamwork, this collaboration actually play out?
Right. So biological dentistry, sometimes called holistic dentistry, it's a field that's really growing. And the core idea is looking at the mouth not just as teeth and gums, but as connected to your whole body systems. So they often focus on things like using biocompatible materials, minimizing radiation, finding alternatives to root canals, or in this case, alternatives to routine antibiotics. And Dr. Jorgensen's story is interesting too. She moved into this approach partly because of her own health issues, gut problems, neurological symptoms, things sometimes linked to mercury exposure, which dentists unfortunately get a lot of.
Wow. So Dr. Jorgensen is thinking about overall wellness, not just drilling and filling. How did she manage to connect with the conventional oral surgeon about Tennyson's wisdom teeth? That seems like it could be tricky.
It's actually a great example of integration working well. Openshaw contacted Dr. Jorgensen, who, it turns out, shared that frustration about the standard, almost automatic prescriptions. So Dr. Jorgensen just picked up the phone and called the oral surgeon. And apparently, the surgeon was surprisingly receptive, open to hearing her ideas, even wanted to learn more, which is, pretty cool.
That is cool. So what were these ideas? What did Dr. Jorgensen suggest that the surgeon agreed to try?
Okay, so there were two main things they incorporated right there during the surgery. First was something called platelet-rich fibrin, or PRF.
PRF, okay.
Yeah. So before the surgery, they drew some of Tennyson's own blood. Dr. Jorgensen prepared the PRF from that blood, and then she gave it to the surgeon to place right into the extraction sites. What PRF does is it creates this kind of natural scaffolding rich in growth factors from his own body. It helps the bone regrow properly and dramatically lowers the risk of dry socket, that painful thing where the clot fails, and also something called cavitation.
It's cavitations. Those sound bad.
They can be. Openshaw mentions they're basically these infected holes or weak spots in the jawbone, and they apparently form in something like 80% of wisdom tooth sites if things aren't managed optimally. And the concern is they can cause systemic issues, maybe related to energy pathways or meridians, depending on your health model. So PRF is about proactive healing, not just waiting to see if there's a problem.
Okay, using the body's own resources. What was the second thing?
The second thing was ozone preparation. Dr. Jorgensen prepared medical-grade ozone, that's O3, oxygen with an extra atom. And the surgeon applied this ozone gas into the sites after the extraction. Ozone is a really powerful antimicrobial. It kills bacteria, viruses, fungi, but without being toxic systemically. It basically cleans the area very effectively.
Interesting. So PRF and ozone during the surgery. What about before? Did Openshaw swap out the prescribed antibiotics for something else pre-op?
She did. A few days leading up to it, Tennyson started taking Noticin. It's a homeopathic remedy they got from Dr. Jorgensen's office. It's sometimes described as a kind of homeopathic penicillin, though it contains no actual penicillin. The idea is it stimulates the body's defenses against infection, but non-toxically. And Openshaw says Dr. Jorgensen's team sees great results with it. So much so that Dr. Jorgensen herself apparently rarely prescribes narcotics anymore and only uses maybe one antibiotic prescription a month. She came to believe, as Openshaw quotes her, that the need for these drugs is in the medical provider's mind.
Wow, that's a strong statement.
It is. And Openshaw also had arnica, another homeopathic, ready to go for pain.
Okay, so a really different prep and surgical support plan. But recovery, that's often where the antibiotics, steroids, and painkillers really come in heavily. What was the post-surgery natural toolkit?
Right. They had a whole plan worked out with Dr. Jorgensen. For pain, they primarily use that arnica, again, the little pellets that dissolve under the tongue. It's known for helping with bruising, swelling, inflammation, and pain. And she also used CBD oil, the non-psychoactive compound from cannabis. It's pretty well known now for pain relief, generally with mild side effects. Openshaw felt that combo, arnica and CBD, made a big difference.
Okay, and what about fighting infection? To replace the usual antibiotics?
That was a multi-pronged approach. They continued the Noticin. They also used something called Immunity Boost, which is a liquid tincture with lomatium, an herb some practitioners really value for immune support. Then essential oils came into play. On Guard, which is a blend from doTERRA, she had Tennyson lick a drop off his hand every couple of hours. And also oregano oil. Now that one is potent. Organic oregano oil, just 2 drops maximum in a capsule, taken with food because it's strong tasting and powerful against bacteria and viruses, plus basic but crucial immune support. Vitamin C, about 500 milligrams twice a day to help mobilize the immune system. And then for keeping the mouth clean locally, Tennyson gently used spry oral rinse a couple of times a day. It has xylitol, which studies show helps reduce harmful bacteria in the mouth.
That's quite an arsenal. And for inflammation instead of steroids?
For that, Dr. Jorgensen recommended a specific supplement called BCQ.
BCQ?
Yeah, the letters stand for its ingredients. Boswellia, which comes from frankincense, curcumin from turmeric, quercetin, which is a flavonoid antioxidant, and it also contains bromelain, an enzyme from pineapple. So this combination is designed to tackle bruising, inflammation, and pain, but also help rebuild connective tissue and support the gut and immune system. It's a much more systemic, supportive approach than just suppressing inflammation.
Okay, wow. So that's a very comprehensive natural plan.
Yeah.
How did it all turn out? How was Tennyson's recovery in the end? And did they manage to steer clear of all the conventional drugs?
Well, the healing itself went really well. No dry socket, no signs of cavitations later on, so a definite success on that front. And yes, they completely avoided the drug antibiotics and the steroids, which was a major goal.
That's huge.
It is. However, Openshaw is very upfront about the pain aspect. She shares that on day 2, the natural stuff, the arnica and CBD, just wasn't quite cutting it for the pain level he was experiencing. So they did end up using the prescribed Lortab, the opioid, and alternated it with some ibuprofen.
Oh.
But, and this is key, it was only for about a 24-hour period. After that, the natural methods were enough again. So while not 100% drug-free on the pain front for that one day, she absolutely still views the whole thing as a major success because they avoided the drugs with potentially bigger long-term impacts like the antibiotics and steroids, and the overall healing was excellent.
That makes sense. It's not necessarily about absolute purity, but about minimizing risk and maximizing natural healing where possible. What a story. It really shows how collaboration, questioning the status quo, thinking outside the box, it can lead to really positive outcomes. You've heard how this one family navigated a common procedure, oral surgery, very differently, focusing on supporting the body's own power to heal.
Exactly. And look, this conversation, this deep dive, it isn't medical advice, obviously, but it is a really powerful example of what patient empowerment and being informed can look like. It underscores that there often isn't just one single path to getting better. You can be an informed advocate for yourself or your family. Openshaw really stresses learning about what natural compounds can do, often achieving similar goals to drugs, but, without those potentially harsh consequences.
So what's the takeaway for you listening? I think it's an encouragement to maybe look beyond the first recommendation you get. Ask questions. Don't be afraid to seek out practitioners who think integratively. Openshaw even provides tools, like she has this holistic dentist finder on her site, apparently with hundreds of biological dentists listed, and offers like a free wallet card with her go-to non-toxic supplements.
Yeah, and just thinking bigger picture for a second, it makes you wonder, doesn't it? What other areas of health could benefit from this kind of approach, where collaboration, challenging assumptions, and integrating different perspectives could lead to better outcomes. It really speaks to the value of a more holistic view, looking at the whole system, not just the immediate symptom, when we navigate our health.
Hey everyone, I'd love to hear how you like my AI assistants, Bob and Betty. If you like this kind of content, we might do more of it. So down in the show notes below, we'll give you the holistic dentist finder that we put together. It's actually some years old, so there have been more biological dentists come into the space, and I'm sure some have retired and sold their practices. Also, a lot of holistic dentists or biological dentists really aren't all that different from regular dentists, besides that they just don't use mercury. So anyways, we give you some resources to check out the biological dentist that you're considering going to, so you can find out how invested they really are in biological dentistry, because there's no real certification for it. There are some out there, but they're just by private organizations. And so basically you're a biological dentist if you say you are. So anyway, these are kind of some thoughts that I have after oral surgery for 2 of my children and myself over the years, as well as some of my thoughts on biological dentistry. Check out the holistic dentist finder that we put together. I'll share it down below. We actually contacted by email, snail mail, and phone every single biological dentist of record in the United States when we put it together some years ago. So I hope it's useful for you, and I'll see you next time.